Welcome to Combinations, the podcast from North Staffordshire Combined Healthcare NHS Trust. Regular listeners to this podcast will know that there are a range of topics and subjects and approaches that we take in this podcast. Some are looking at moments of insight, some are sharing patients and service users' perspectives and stories, and some are there to commemorate days that we think are particularly significant. And that brings us to today's topic. We're recording this podcast in Hartlands Hospital at the end of World Delirium Awareness Day 2022. And to mark that day, we have also launched an innovative new product from the Trust called Combined Virtual Reality. And to explain how we've brought those two developments together, and how it was produced and the impact that we've seen over the day, we have a number of people here in the room. And so if I could just start by asking just each of you to just say your name and what your role is with the Trust, or indeed, as we will come to hear, in our colleagues at UHNO.
Hi, I'm Abdulaziz. I'm one of the geriatric registrars. I joined UHNM in September 2021, and I really enjoy being in different departments.
I'm Dr. Becky Chubb. I'm an older adult and liaison psychiatrist here at Combined.
Hi everyone, I'm Dr. Saad Khalid and I'm an internal medicine trainee at the Royal Hospital.
I'm Kyle, I'm the digital content lead for North Combined.
My name is Kate Dobbs, I'm a fourth year medical student at Keele University.
Okay, well thanks very much everybody. Becky, I do need to start with you, do I not? Because the ultimate reason why we're all here is because of a fantastic idea you came and talked with me about. How long ago?
Don't know, a year ago, something like that originally.
Okay, what was the idea? Tell us what your vision was.
So, my vision was to, I guess, increase awareness of delirium, but in a very different way. So there's quite a lot of delirium training out there that takes place day to day all over the country. But I hadn't really seen anything that put the staff member in the patient's shoes. Nothing that really kind of got under the skin of delirium and allowed that staff member to really appreciate what it might feel like to experience an episode of delirium. So my idea was to do a virtual reality delirium film whereby you put on the VR headset, and as you do that you become the patient. And you experience the hallucinations, you experience all the altered perceptions and odd thinking that goes hand in hand with an episode of delirium.
Okay, so that was the vision and that was the idea. Now obviously lots of people can have visions, lots of people can have ideas. We need people who can actually make these things happen. Fully enough to turn virtual reality into reality to Game of Thrones. So, which brings me on to Kyle. Kyle, you're the digital content lead for the Trust. You've been with us,
8 months, I think now.
8 months.
Yeah.
8 months. And I remember coming to you and saying, Dr. Chubb has got an idea. Would you like to tell me what your reaction was and how you thought we could have done this?
Yeah, it's my first VR project. I've always wanted to try it and dabble with it, and never had the equipment. And obviously, you came to me and you went, I've got a 360 camera here. I want you to do this project. And instantly, it was like, I have no clue what delirium is. So I had quite a few meetings with Becky. She took a few times to explain what it is, and I sort of got the vision. I thought, right, if you can get a script, I can have a look and have a think of how we can do it. And some of the stuff that we came up with, like there was like floating baby dolls, I think was going to come out of one. And I thought, how are we supposed to do that with this piece of equipment? So I told Becky sort of like, just come up with some ideas that are feasible. So I gave her some like ideas of what would work and what wouldn't work. And I said, I'll leave it with you. Send us a script and we'll see. And turned up on site, and not only did you come up with a good script, it was a director role. I think you had on the day. So.
And of course, all good films, you can have directors, you can have camera people, you can have producers, you can have editors, but it is nothing without the actors. Which brings me to Kate. Kate, how did you get roped into this nefarious idea?
Oh, I don't know. Dr. Becky, taught psychiatry, the mental health block for my year group last year. So she kind of introduced us to psychiatry, and the people that were more enthusiastic about it, which was a couple of us, we kept in contact with her. And after, I don't know how long, she messaged and said, "Oh, I'm doing this thing. I wonder if you want to do it with us." So that's how I got involved.
Brilliant. And had you ever done anything like this before?
I've done a little bit of acting before, but never like this.
Have you now?
Yes.
Well, there's something we didn't know. Where have you done acting before?
I used to do dance and drama when I was younger.
Wow. Well, that ruins my segue that I was going to say. But, with all innovation, I was about to say, so none of us have done anything like this before. Obviously, none of us have done any of this before, apart from, obviously, Kate, who'd done dancing and although there was no dancing involved in this version of the film as I see it.
No.
That's the next one. We've already been discussing about Delirium Experience 2. It's more of a horror film. But...
Some creepy dancer in there.
Okay. So let's move this little story on slightly. So we've got a vision. We've got some willing actors. We have a VR camera, and we've got the attitude to make it work. So who'd like to tell me literally about how literally did we put this thing together?
I mean, I can start. We had to build a patient, which was one of the funniest things when we got there. We knew the camera had to go in the centre of the bed, and it was like, how do we make this look realistic? So a few of you went off and found some towels, and they constructed some legs to the point where they were all agreed going, yeah, that's correct, that would be, is it autonomy? I don't know what the word is, but you're all like using words to describe the legs very well. So that was that's the one, yeah.
It was anatomical, we even did knees. We did.
Anatomy, not autonomy. Right.
I remember how big it was, I don't remember what they were saying.
Okay, so we had, as I understand it, we had a bit of a rough script.
Yeah.
A bit. Now I don't know. For those people who understand film, they'll know that Mike Leigh, the way in which Mike Leigh does all his films is there is no script. He literally just chucks all his actors in there, tells them broadly what's going to happen, and lets them get on with it. And from what I understand from this production, it was a bit of a Mike Leigh production, was it not?
It was certainly a bit of a wing it and hope for the best, but what I would say, where the script originally came from is that it was really important for me that all of the experiences that we showed in the film were based on real patient experiences. They weren't things that any of us had made up. They're real patient experiences that have been reported to me over the years, and that was really important to me, that it was based on real patient stories. But I guess how we then made that up, was a little bit of wing it and hope for the best. There was some trial and error involved.
On the day, I remember on the day we just got loads of people and were like, you can do this role, and you can be the patient, and
you kept telling us off for moving changes.
Yeah, obviously continuity. It's key in film production, and it was like, don't move the glasses. So it was a fun day.
Brilliant, but I do think that's quite important, isn't it? That obviously we're being very light-hearted about talking about this, and it's been enormous good fun to do it, and we'll come on to the experiences that we've just gone through today in a minute. But the really important thing is behind this, it is also clinically robust. It is, and I remember when you were first talking to me about it, and you were explaining, no joke, they literally would hear World War II sirens. They would see they would see bombs dropping, and me jaw just dropping, because of course the general public don't know this, and at one level it almost seems like fantasy itself, but that's partly the reason we wanted to do this, wasn't it? So you might think this is fantasy, but it really isn't, and it really makes a difference.
Yeah, absolutely. And for me that was what's given it integrity, I think.
Yeah. So we got together and we produced a film and all of that, and then I remember we were looking for, you know, when would be the right time to publish this, you know, when we could do this any time, and along comes the idea of World Delirium Awareness Day. So would you mind, Becky, just telling us just a little bit about what World Delirium Awareness Day is and what the idea of the day is?
Yeah, I mean, it kind of does what it says on the tin, really. So I came to know about it probably a few years ago now, and it's something that's publicised an awful lot on Twitter, and that's how I came to know about it. But it is literally clinicians from all over the world, over a 24-hour period, who will do a variety of awareness campaigns, education sessions, all sorts of things all over the world, and then share with each other basically, and it's there for anybody to swap and share ideas in the bid really to just increase awareness and understanding on delirium.
Right, and for those of you listening to this podcast, what we'll have at the end of this discussion is, over the course of the day, we've been filming and recording the reactions of frontline clinicians who've been experiencing the film, and then hearing what they say about it. And almost universally, as we'll be able to hear at the end of this discussion, the reaction has been, I am a medic, I care for people with delirium, this has shown me something that I really wasn't aware of. So if we had to have a better result on World Delirium Awareness Day, I don't really think we could have wished for that. So which of course brings us today. Now, one of the good things about this part of the world is the really high level of partnership working between ourselves here at Combined Healthcare and our colleagues at UH&M. For those who are not familiar with the geography of the Harplands Hospital, which is our main hospital setting, is co-located with Royal Stoke at UH&M, and the degree of joint working is remarkable between the two trusts. And so today we've actually been unveiling this film in a series of meetings and events around UH&M, which of course brings me to Abdul and Saad. Abdul, first, how did you first hear about this initiative, and what made you want to get involved?
So one of my colleagues, he was doing an attachment with Dr. Chop, and so he sent a message on our WhatsApp group that there is a World Delirium Day, so anyone who wants to get involved. And I was thinking, what is World Delirium Day? So I went online and I read about it, and I said, yes, I want to get involved. So that's how I knew about it. Yeah. So I really enjoyed it, and I think it's a very good initiative, because as a geriatric registrar, I was not aware of it, and not many of my colleagues were aware of it. So I think it is a really good initiative, yeah.
And now, when we were talking first thing this morning, when we were getting together, you actually told us an absolutely fascinating little backstory to this that none of us knew at all, which is, in fact, you yourself have experienced something akin to a delirious state. Do you want to say a little bit about that? Because that's fascinating.
So, early 2020, I got COVID, and I was admitted 2 times to the hospital. The second time when I was admitted, I had a bit low oxygen saturation and a high fever. So I was in a bed with 3 other elderly people, and they were all delirious. So we had a window which we couldn't see outside of it, and it was end of the day. I couldn't see anything out, and I was thinking, I'm in the middle of the sea, and I'm in the boat, and we are sailing. So I called the nurse and said, are we really in the sea and in a boat, and are we going to sink? And he says, well, don't be funny, you're in the hospital. And I was thinking, I'm not picking this, and I'm really feeling, I had that, the real feeling that I am in the boat and I'm in the sea. If you have high fever, and then you will have that sort of feeling. And then I saw a healthcare assistant, or it was a cleaner, who came in and put her hand on my shoulder and said, well, I know you are poorly, you're on oxygen and you have a high fever, you will be okay, you are in the hospital, look around you, you have 3 other patients with you, so you will be okay. And I was really, shocked with that feeling. I cannot explain, but that is something horrifying experience.
And that member of staff coming and reassuring you and being empathetic, what effect did that have on you?
So what I found was, and I found that is a real patient experience. What I found was the cleaners and the healthcare assistants, they were more and more, had a good relationship with the patient and me, because we could see them most of the time. But then the doctors who came and they spent like a minute or two, and they listened to my heart and talked to me very briefly, end of the bed, and then I wouldn't see them till end of the day, and I felt heartbroken. I'm a patient, I have to have the doctors with me, but I could understand that it was a COVID time and everyone wanted to be away from, from the patients, especially from the COVID positive patients. But what I understand is some of the stuff that we don't value them a lot, they are really near to the patient, yeah.
Yeah, so we're great in the NHS, aren't we, in having sort of trite phrases that sometimes trip off the tongue quite easily and all of that. And sometimes, sometimes they just do. Sometimes they really do mean something. And obviously, one of the things we always talk about is treating people with compassion and the importance of compassionate care.
That is very important.
And it seems to me that I know when you were planning this film, Becky, it wasn't just that it had to be clinically. Of course, the clinical accuracy is fine, but one of the main points about this was to give people a sense of empathy. To just think what a difference it can make, and we will have a link, obviously, in the write-up of this podcast to the film. But that's one of the main messages of the film, isn't it? The simple act of compassion from somebody saves the day, type thing, and
absolutely. And the whole point of the film is that it's really simple, really, that there's nothing complicated. What you see in the movie is someone experiencing a delirium, and essentially through some basic interventions of staff they come back out of the delirium. And the point of it is, it's just the real basics. So it's making sure somebody can see properly with their glasses, making sure they've got their hearing aids in. It's the real basics. And I think what was different with this was it wasn't about teaching people about delirium, it was about trying to encourage empathy in staff for somebody with delirium.
Yes, and again in the interview excerpts we'll have at the end, which were all spontaneous, one take things. The number of people who said, it just brought home to me the importance of just think about the glasses, just think, okay. So, sorry, if I could come to you. Obviously, you've been coming around with us during the day as well. You've been part of the crew. So, how did you get involved in this?
So, as acute medical doctors, junior doctors, we have to work with registrars, which are middle grade doctors, which in my case was disease. We have to work with them. So it was just one of those instances where I was just discussing different things with disease, and then he just informed me about this idea, this initiative that they are doing this World Delirium Day, and they have this whole project planned for that day. So a good number of our patients which we see in the trust as on the front door are patients who are delirious in one way or the other way. So, and as you mentioned earlier, is this that, and as Dr. Chubb mentioned earlier, was this that it's not always about the medical side of things, it's about the empathy and communication sides of things as well. So I just liked the idea and I just wanted to be a part of it, and it was a very good experience. Not only was I raising awareness among different members of the staff at the hospital about delirium, the word delirium and everything, but at the same time I was learning myself as well. There was quite a bit of things which were involved during this whole exercise. It was about delirium itself, it was about well, actually this is the first time I'm doing a podcast, so yeah, so it was something, it was exciting for me. Leadership, communications, how to use technology, to raise awareness, to spread the knowledge. So it has been a very good experience for me today. Yeah.
Fantastic. So, so I guess like most things, sometimes some of the best achievements are just when something just magically comes together. Yes. And it just clicks. And I know for myself, having having conducted some of the interviews, just hearing people come back literally just saying, I've never used VR before, it's really good, I've really learned something special, and specifically things that we wanted them to learn, you wanted them to know about. It's just been great. So as I say, the idea of this podcast was simply, as I say, sometimes what we want to do, we want to mark a special moment in time, and I think this is a special moment. Today has been a special moment, and as I say, at the end of this, people, we're going to finish off with some reflections from frontline staff across UH&M. We'd really like to thank our colleagues at UH&M, both in clinic and also in my colleagues in the comms team there, for allowing us to go around their facilities and film and everything. And everybody has been immensely welcoming. The takeaways. Let's just finish with if you just had. Oh, sorry, Kai.
I was just thinking. Me and Dr. Becky Chilwell have been working on this project for a long time, and Becky's been inputting, saying, "Oh, you need to do this." But to see Becky use it on the VR headset today, looked like she'd never used it before or seen it. Sorry,
of course, I should have said you never actually saw the final product until today, did you?
No, not in virtual reality, and it really is so different. It really is absolutely amazing when you put the VR headset. It's a completely different way of learning, and for me, I'm quite a visual learner anyway. But if I, for me, I would take home more messages and more learning from 3 minutes of that than I would an hour's lecture on Delirium.
And if we go right back to the start on your idea, was this what you envisaged? Was it better? Was it worse? Was it different?
This is way more. When I first got in touch with Kyle, I had no idea what was even possible. So I basically just gave him a menu of ideas of things that patients and family members, my grandma had an episode of Delirium, have reported to me, and between us we just kind of worked out which bits would work and which wouldn't. And to see staff members' reactions, to just hear people say, "Oh, I get it, I'm really going to think about this now, it's just the basics, this makes so much more sense to me," that is absolutely everything I hoped for. Brilliant. And
as we mentioned at the start, the use of virtual reality is something that, as a trust, that we want to be exploiting, and this is our first attempt at it. And it's almost one of the most dangerous things we've done, because we can already see how many people will grasp it and say, "Could we do it for this? Could we do it for that? Could we do it for this?" So it's a great day, a really great day, and a very worrying day in terms of the capacity of us to cope with this enthusiasm we've done.
When we spoke to the staff after it, though, they were giving some really good comments about it. And obviously I've used VR before, I've used it for all different types of experiences. And one thing you do know is you're quite vulnerable, because you lose all your peripherals. And the people that were watching someone use our experience were saying like how they looked vulnerable in that experience, and it sort of gets you in the mindset of the patient as well, because they're lying there, they can't move, you can't go anywhere. So you really got into that experience as the patient.
Yeah. Okay, so there we are. So we're going to wrap this up. As I say, what you'll hear now is a series of interviews with people who have donned VR headsets, the vast majority of them for the first time in their lives, and tried it out. And you'll hear their reactions. If you want to know more about World Delirium Awareness Day, you can search for it on Google. It's very, very active on social media. Is there a particular website as well, or is it done by an organisation, Becky, or is it?
I don't think there's one website per se. But there's lots on Twitter. If anyone's on Twitter, it's really, really easy to find on Twitter.
Right, okay, and you engage with that. And also on there, we haven't even got time to talk about the other fantastic training aid that Becky and colleagues at UHM were putting around today, which was a spot the difference between the two patients, which you can find on social media by going onto our Twitter feed and looking on World Delirium Day. So we're going to end this up. We're going to end this now. For those of you, if you're interested in the Combinations podcast, it's almost our 3rd year anniversary. There are over 30 episodes on there now of all types of material. We'd really welcome any interest or feedback. But for now, we'll leave you with voices from the front line at the UHM in Stoke-on-Trent on World Delirium Day 2022. Thank you very much.
Thank you.
Thank you.
Thank you.
Yeah, it was quite good. Yeah, it's okay. It does make you realise though when we take people's glasses off and hearing aids that what we actually do to them. I know it's, do you know what I mean? It's like everything went, but it was already a bit blurred and then it went completely blurred and then they just hear all these voices. So yeah, it is good. It does make you think.
To actually give that insight into what the patients are actually experiencing, I suppose, is very interesting for us because obviously we see it on a regular basis here, but we don't really know what it's like for that patient to actually to suffer from delirium.
I think when I saw 2 people with the virtual reality on, what struck me is that normally someone experiences delirium, you don't see, it's invisible, but by having the virtual reality on, it's like that barrier between you and them, and you realise how just isolated that person is because they've got this almost this barrier of the delirium surrounding them. And it was just seeing that how vulnerable they are and how isolated this just makes them. And even if people approach them, they're still disconnected. The delirium's causing that layer of disconnect, really. That's what I observed.
I did quite a bit. I think it's nice to see stuff from the patient's eyes. So next time I have a patient with delirium, I'll try and be more understanding and empathic about what they're going through.
It just gives you a better idea of what the patients are going through when they're experiencing delirium, and can make you appreciate how hard it is and give you an idea of how you can make it more comfortable. I think any of these kind of acute conditions that patients can present with could be kind of replicated in VR. We can use that in training. We do a lot of simulation, but VR maybe takes it a step further, which would be really beneficial to see what it's like to be the patient rather than just practice what it's like being the doctor.